Okay. Hi, everybody. Dr. Rafich here, Vet Triage. It is 2 p.m. Pacific time, August 29th. So far for being consistent with these. Anyway, let's talk about zoonotic diseases in brief. So zoonotic means anything that can be passed from animal or non-human animal to humans. Yeah, there are some that are pretty common and dangerous or not dangerous. There's some that are super rare, dangerous or not dangerous. So before I move forward, recognize, of course, there are many, many zoonotic diseases that I'm not familiar with, especially if you're a veterinarian who works with non-human primates. It's much more of a concern for, viruses that cause like hepatitis or immunodeficiency virus or whatever. So, and there are also diseases that are considered somewhat archaic, like the bubonic plague, tularemia, and you get the occasional outbreaks of these things, but I'm not an expert with those things because they're not very common. So we'll talk about some common ones. So first one that comes to mind is rabies. Rabies virus is 100% lethal and is so one of the most scary zoonotic diseases. Thankfully, with rabies vaccinations being so prevalent and so efficacious, we don't see too many rabies outbreaks. It is considered, I think, endemic in some populations of animals like raccoons or something, and raccoons, of course, are number one suspect. Bats, I think, number two. From there, it's like skunks and other mammals, but rabies is a scary one. And so definitely get your pet vaccinated for rabies. And if you are a human being who works around mammals, then make sure you get your rabies vaccination as well. I have mine as a veterinarian. Keep in mind some salient points. Rabies is not passed by blood. It's passed by cerebrospinal fluid, so CSF fluid. It's passed by saliva, but it's not passed by, it can be passed by eliminations, I believe, like urine, but not blood. And the second misconception is that it's only between mammals. It doesn't affect avian, reptiles, fish. So that's rabies for you. If you're worried about exposure to rabies for yourself, then you need to see your physician. And if it's your animal, you need to see what the laws are in your state or province or country regarding rabies. Some require a booster vaccine, some require quarantine, some require both. And the length of time for the quarantine is dependent on the area, and the booster regimen for rabies also dependent on the area. So you have to look into that. A simple Google search will probably figure that out. Otherwise, the veterinarian in your state or province or country should know what the rules are for it. So that's rabies in a nutshell. Second one, ringworm. Ringworm can be passed on from your animals to people. It's thankfully, in most cases, pretty benign in terms of like not being life-threatening. There are, of course, some rare cases that it's severe in people and animals. But for the most part, your run-of-the-mill ringworm, which is a fungal infection or yeast infection, is pretty innocuous. It's just kind of more annoying and gross. In fact, classically speaking, unless there's a secondary bacterial infection, they are not even itchy with ringworm. But yeah, passed on from animals to people. And I don't know if people can pass it to their animals, but in any case, it is one that if you see any lesions on yourself as a person, go see your doctor. And for animals, it's a pretty annoying, lengthy treatment. And, it's hard to diagnose sometimes, but you definitely want to get your vet involved or talk to Vet Triage, and they'll help you through it. But ringworm is another zoonotic disease that we see. The COVID virus, coronavirus. So other than COVID-19, which there were sporadic reports of it infecting animals, I don't know its zoonotic potential. Obviously, if it did come from wet markets or whatever, then clearly that's being passed from animals to people, in which case it is considered zoonotic. There are more common variants of coronavirus that dogs and cats have always had, and those are not communicable to people. So if you hear reports of coronavirus in animals, it is important to specify which one if they know. And for the most part, even with COVID-19, it seems to be a very rare thing. But outside of COVID-19, other viruses are not zoonotic. So that's another one that we can talk about. Another disease that can be spread is Giardia. Giardia is a protozoa. It's a parasite. It's spread through wildlife, and puppies especially are prone to having Giardia. And if you're a person, especially if you're a person who's immunocompromised, in fact, just to backtrack, like with ringworm, if you're a person that doesn't have a strong immune system, maybe you're elderly, you have cancer, you have AIDS, you're undergoing radiation or chemotherapy for cancer or whatever it is, if you have an immune disorder or something, ringworm and Giardia will definitely hit you harder than a person who's immunocompetent, who has a strong immune system. So Giardia can be contracted to people from like cows, from wildlife like beavers, and and so that's one that you have to be careful of. Not necessarily life-threatening, but if you do live in an area where like medical care is very good and you have no way of correcting for dehydration, if you have really bad Giardia, it can be quite dehydrating because it's a diarrhea type thing. So it can be scary or life-threatening, but for the most part, it's well, anyway, I've never known anybody that's had Giardia outside of vet school from getting it from cows. But yeah, usually it's a bad course of diarrhea, and you need lots of fluids to get through it. But don't take my advice, my medical advice for that. I'm just saying that Giardia is another zoonotic disease. You need to talk to your doctor about it, and or your veterinarian regarding your animal. So let's see. I think it's probably good for now. There are many others, but I think we'll stop there. If there's more interest in this, feel free. Those who watch us in the playback, let me know if you want to hear more about it. Otherwise, we will look forward to another live stream tomorrow, August 30th. And I don't know what time. We'll try in the morning. But thanks for those who support the channel, those who watch it in the playback, and we'll talk to you soon. Bye.